today we are talking about how to set up a Parvo metabolic cart, but first we are going to put together the two-way Hans-Rudolph valve face mask. First we have the main piece, and we are going to attach other pieces to this to make the Hans-Rudolph two-way valve. So you have a little diaphragm, and you want to make sure that air will be flowing in through the white piece. So attach it to where, if you press it with your finger, it goes in. And then put it on the main piece and make sure it is tight, but not too tight. And then we will take a second clear piece to make sure the air will flow out as well. And so we will take another diaphragm and place it in the clear piece with it going out, and screw this on. And again, tight, but not too tight to where you cannot unscrew it. Next is the spit valve. This is when it is in the participant's mouth and spit can accumulate here. It just fits in perfectly on the bottom of the valve. And then next we have the mouthpiece to put on. First you have to put a little connector on. And so screw it in like so. And then you actually have the actual mouthpiece that you put in the participant's mouth. And what you want to make sure is pinch to put it on. And then to have about 1/4 of an inch from the actual silicone mouthpiece to the main part of the valve. And there you have it. So next, to actually attach the mouthpiece to the Parvo metabolic cart, we have to attach it to a plastic tube that is actually attached to the Parvo. The reason why this plastic tube is suspended from this arm is because when a participant is on the treadmill, they want to be able to not be constricted to where their head can be when they are doing a VO2 max test. So to do this, simply, you want to make sure the white valve is facing away so that air can flow through when you are breathing through the test. And so again, pinching the tube onto the clear part and making sure that it is snug on there and 1/4 of an inch from the actual valve to give enough leeway.
Okay, now we're going to talk about gas calibration and how to turn on the computer. So first off, to turn on the computer, you will go back here behind the computer. There's a master switch on top that you switch over, turns the computer on. Then what you're going to have to do is this: come onto the computer side, turn on the CPU as well. You then go to True 1, click on it, and open it. During this time, the mixing chamber takes relatively 20 minutes to warm up. So therefore, before you can start and run a test, let the mixing chamber warm up. So after you've turned on the computer and opened up True 1, you're next going to do the gas calibration. This is the 4th tab down on the left. You will click this. A gas analyzer calibration setup will come on. To put in these values, you see this weather center here. This comes up with all the values that you will need. So for room temperature, you put in whatever temperature it is. For your Celsius, relative humidity is 70, and barometric pressure is 756. After that, click OK. And then you'll be prompted to turn on the gas cal to 3 psi. So you come over here, and this is in the off position right now. You're going to turn it counterclockwise 90 degrees to the on position. You then click OK. And now it will analyze for 15 seconds. Gas cal has analyzed for 15 seconds. You will then be prompted to turn it off. To turn off the cal gas, come over here, turn it clockwise 90 degrees to the off setting. You then click OK. And now it comes up the change in percent difference. There should be a change in percent difference less than 2%. If it's greater than that, you have to redo the gas calibration. But as you can see, we are in the range, so now we click Save. Next, we'll be doing a flow meter calibration. You will need your 3-liter calibration syringe to do this step. So you're going to take the tube, plug it into the 3-liter calibration syringe. To do this, pinch the tube a little bit to slide it in. Now after this is securely in all the way, you will then click flow meter calibration. This is the 3rd tab down. Okay, it's now going to ask you to sample baseline. You're going to sample baseline. Next, you will do 1 flush. This flush is a recognition flush. Go all the way out and press it in. Make sure not to bend this plunger at all. Next, we'll be doing 4 flushes. All the way out, all the way in. So for the first stroke at 50 to 100, you pull it out all the way and go up to the designated height. After you do it, you would like to get this within 2% of 3. If you do not feel that this is adequate, you can go here and cancel. There's a cancel 3.024. So we're going to cancel to redo this again. And then go back to the 50 to 100 liters per minute stroke. Okay, as you can see, that's closer. We will accept that. And now we're going to the second stroke at 100 to 200 liters per minute. Okay. That one is not as adequate as it should be, so we're going to redo that one. So we're going to cancel 2.985. First stroke will be done at 200 to 300. Okay, as you can see, that's acceptable. The 4th stroke will be done at 300 to 400 liters per minute, so a little bit faster. Okay, we'll be done at 400 to 500 liters per minute, and this will be the fastest stroke. Okay, after this is done, it will say in calibration. To save this calibration, you're going to hit click save, and now you're ready to perform some VO2 testing.
So to begin testing with the metabolic cart, we are going to set our participant up. We are going to first place the headgear on our participant. So you start like so, have the knob in the back, and tighten the knob in the right direction until it is comfortable for the participant. Are you comfortable?
Yes.
Okay. Next, you're going to place the mouthpiece in the participant's mouth. Make sure that their lips are over the entire mouthpiece. Make sure that the side plastic of the headgear is loose, and you will place the mouthpiece in the hole. Make sure that the participant is comfortable where the mouthpiece is, so it's not dragging them down during the testing. So is this a comfortable position? Once it's comfortable, tighten the side of the headgear like so. And next we'll have our participants stand on the treadmill to hook them up to the metabolic cart. So as they're on the treadmill, you're almost ready for testing. Just place the tube over the clear valve. You have to give it a little pinch. During VO2 max testing, it's very important that our participant breathes fully into the Parvo so we get all of the gas concentrations. So we're going to place a nose piece on the participant's nose so that they cannot breathe through it. Due to the strenuous nature of the VO2 max test, it's very important that your participant knows how to safely dismount from the treadmill. So Brian, why don't you show us the proper way to dismount from the treadmill? This is very important in case your participant becomes fatigued and the test needs to stop immediately. To disassemble the metabolic cart from your participant, you are going to work your way backwards. So we're going to start by taking the tube off, like so. Also have a paper towel handy because a lot of spit happens during the VO2 max testing. So we're going to take the tube off, then we will take the mouthpiece out. Feeling good? Next, we will take the head here. we will take the tube off of the gas mixing chamber to clean all of the
Alright,
equipment.
so now we're going to clean the parts from the Parvo machine. So one thing is important to note is that the silicone piece that was actually in the participant's mouth, you do not need to put this in the Sidex solution of which all the other pieces are going to go. So the mouthpiece will actually go in warm soapy water. And then we unattach all the other pieces, and these are going to sit in a Sidex solution for 20 minutes to fully disinfect the parts. Another thing to note as well are the diaphragms that were put in the two-way Hans-Rudolph valve. They do not need to go in the Sidex solution as they are silicone as well. So these are under warm soapy water.
The headgear will be washed under warm soapy water as well. To clean the tube, you want to place warm soapy water in, so just a little bit of soap and warm water. Then you will want to run the soapy water through the tube a couple times to ensure that the inside is all clean. So to dry the tube, we're going to hang it right here on our lovely drying rack. To dry the headgear, we're going to place it over on our drying rack over here. And then we will place our diaphragms up to dry, as well as our mouthpiece.
To properly dry the pieces that were in the Sidex solution, we simply take the pieces out of the Sidex solution and put them on the drying rack. Values for VO2 max for age 18 to 25 men. Above 60 milliliters per kilogram per minute is in the excellent category. 52 to 60 is in the good category. 37 to 51 is in the average category. 30 to 36 is in the poor category, and below 30 is very poor. For women age 18 to 25, 56 milliliters per kilogram per minute is in the excellent category. 47 to 56 is in the good category. 33 to 46 is in the average category. 28 to 32 is in the poor category, and below 28 is in the very poor category.